Looks like we're live. So hello, everyone. I'm just going to give everyone a second to join and get oriented, but we just have an hour, so we'll get to it pretty quickly. While we take a few beats for everyone to get settled in, go ahead and introduce yourself in the chat box so that we can all see who we're with today. And as you're doing that, we just want to say that we've been looking forward to this session, so thank you for being here. The way that we'll be able to engage with each other is through the chat box, so that's where you can ask questions and make comments for us. We will have time at the end, definitely for Q&A, so please utilize the chat box. And we have many materials that we've made available for your download on the platform. So we have our slides that you'll be seeing today, as well as other materials that we'll be talking about. So here's what we're aiming for everyone to gain from this presentation. So we'll be talking about different angles for addressing student engagement. We'll be learning about how to build and grow partnerships between schools and external organizations. And we'll be talking about ways to fold in data and community voice sort of into your plans and processes. So I'll very quickly introduce myself, and for the sake of time, Maria and Chris will introduce themselves later. This is the order of who you'll be hearing from today. So I'm Rachel Leiber. I'm a social worker and senior impact manager at United Way of San Diego County, and I help oversee the initiatives that we'll be talking about in today's session. All right, so we're going to dive into it. So in order to talk about our work and the shift that happened due to COVID and what we're doing now, we have to back up a little bit and talk about where we were. So starting in 2015, we had an initiative that focused on improving student attendance, and this was called Every Student Every Day. We did this initiative in City Heights in schools that are part of San Diego Unified, as well as with Lemon Grove School District sites. We partnered with upwards of 20 schools in this initiative. And we know that attendance is complex, and there are many foundational reasons that either support or hinder a student being at school as much as possible. And obviously, underlying family stability issues have a major impact on a student's attendance. We did this initiative in partnership with others as well. For example, we partnered with San Diego County HHSA, where outstationed eligibility workers would come to our partner school sites and help families get connected to public benefit programs like CalFresh and Medi-Cal and CalWorks, and work with our families to ensure that they're enrolled for the programs that they're eligible for and continue to recertify if needed. This was primarily an intern-based model, and so we were already planning on reimagining our model of support with schools coming into this school year that we're currently in. Because with an intern-based model, schools were very reliant on receiving an intern each year, so we wanted to think of a way that we could provide support that was more sustainable, and also think about student attendance and academic achievement more holistically. So we had already pre-COVID, we were planning on a new model that included community-wide attendance messaging, more individualized supports to student literacy, and at the most intensive individualized level, focusing on family stability. So then COVID happened and we took a pause, and we said, okay, how flexible can we be with these plans that we had? And we gathered our school partners in May, and we listened and we said, all right, if we are going to support your students and families this coming school year, what is the best way that we can do that? And we heard loud and clearly that we have to go back to basics and really focus on family stability, which we were planning on having as this more holistic model of support, but we hadn't planned on starting there. We had planned on working up towards that family stability level. So in light of that, our Every Student, Every Day initiative about attendance became Every Student, Every Family, and focusing on family stability for this coming school year, and the devastating impact that the COVID-19 pandemic had on community residents. So that's where we were. That's the shift that happened. And so thinking about a one-year COVID response to support students and families, we had to act quickly, to pull something off in a short time frame. And so this slide that you're seeing now kind of summarizes the steps that we planned to pull off this new work, utilizing partners to support family stability in 1 year. So this is a process that we're using for all of our Every Student, Every Family sites. This includes City Heights and Lemon Grove, which I'll really be focusing on. We also do this work in Escondido, which you'll be hearing about later on. So I'm going to dive deeper into the steps that we've done. So this preparation phase, this is really where we were at coming into the school year. So when we gathered our school partners in May and we heard that we have to go back to basics, we heard that there were some major buckets that we could focus on that families were really struggling in. We heard that there was mental health needs for the adults in the home as well as students. We heard that childcare was a major issue, as well as housing insecurity and food insecurity. So we had already identified our priority need areas, but we needed more information and we needed to confirm that these buckets were what community residents would identify as priority areas as well. So we looked at what data was available from other local sources out there, but we also wanted to really hone in on the needs in City Heights and in Lemon Grove areas. And not only did we want the major buckets, but we wanted to hear what were the barriers contributing to each of these buckets and what ideas did community residents have themselves for what would help. So that's sort of like this perfect data set that wasn't fully available from the other sources that we had found. So we said, all right, we need to gather this data in this really kind of intensive community voice, but we can't do it ourselves. So again, engaging with partners who really have great direct relationships with folks in City Heights and Lemon Grove to gather this information. So we partnered with our Every Student, Every Family partners to get this done, as well as folded in additional new partners to accomplish this survey. We ended up having a total of 16 school sites and external organizations help us collect this information from community residents. And the reason why we spent so much time and effort doing this is because this information was really going to inform with our Every Student, Every Family partners where we were going to focus our efforts and what was the response going to be. So I'm going to quickly show the data that we collected because this is all available for your download. So in total, we had 326 survey responses. And you'll see here that food insecurity rose to the top for both City Heights and Lemon Grove. Our survey, which you can download the actual survey questions that we utilized, the survey also elevated the top barriers contributing to each of these buckets. So for example, in food, the major barriers that folks identified was the limited hours of food distribution operations, as well as just a general lack of awareness of the resources that are available around food. So what did we do with this and how did we do it with partners? So we all know that getting a large group to come to consensus and make decisions is difficult, just in general, and we had to do it virtually. So what we did was we analyzed this data, we prepared it for consumption by all of our partners, and what we did from there was we had different lenses that we used to identify out of those 4 major buckets, which is the one that we're going to focus on this year to support students and families. And then from there, really looking at the barriers that rose out of the survey results to say, what can we do in that bucket area? So these were the lenses that we utilized. Deciding a focus area was a process. So first and foremost, we used data and community voice that came out of the survey results, but then we had these other lenses as well that we folded into our process. So we assessed the data with our partners. We used these lenses and we had discussions around, all right, what is that bucket area that we are going to focus on? And we had small groups of our partners create pitches for ideas of why we would need to focus on a certain bucket for this year. And then we voted. So for both City Heights and Lemon Grove, we landed on food insecurity for this year, using the data and using these lenses. We also use these lenses to finalize a strategy. We know we're going to focus on food insecurity, but how is it that we're going to do that? So we heard that the major barriers in food insecurity was around the hours of operation not being as convenient as they could be for families. And we just also heard that lack of awareness of what is out there was contributing to folks not accessing needed resources. So again, we used our data and community voice and these lenses to decide on the strategy that would be used in both City Heights and Lemon Grove to address food insecurity. So this is where we landed for both regions. In both City Heights and Lemon Grove, there's going to be a focus on increasing awareness of hunger resources, because through the data that we collected and talking with partners, it became very, we became very aware that there's lots of great resources out there. It's just a matter of people knowing about them. And also due to the data, we decided that in Lemon Grove, we would also establish an additional food distribution time at one of the school sites that might work better for families. So in late afternoon, early evening time, so that more families could access this resource. So to recap kind of all that we did from May through now, we elevated community voice and we used data. We rallied our partners to pivot due to COVID and hear what is the best way to support students and families right now. And we're going back to basics and focusing on family stability so that students can have what they need to hopefully be, present in school, whatever that looks like for them, and ready to engage and not worrying about having a hungry belly or where their family might get their next meal from. So where we're at right now in this timeline is we've picked food, we've picked our strategies, and so now we need to be getting ready to implement this response, which is what we're activating our partners to do. And we are not trying to create something new. Really, we're trying to leverage the resources that are already existing out there, which is important, especially now in COVID with folks being spread so thin. We really just need to harness what is available in the community. So moving forward, this last phase, we're going to begin acting, and then we'll launch our strategy. We'll set goals and have a data and evaluation plan. And we're going to measure our outcomes against our goals. How are we doing with raising awareness in these two communities about food resources? Is this additional food distribution time in Lemon Grove, being utilized as well as we hoped by families? We're going to measure the work. We're going to convene our partners monthly and evaluate and report back to our stakeholders. So that's our sort of quick deep dive into City Heights and Lemon Grove work and the shift that happened due to COVID. So now I'm going to hand it over to our work happening in Escondido and hear from Maria.
Thanks, Rachel. Okay, hello everyone. My name is Maria Horsley and I'm an impact manager at United Way. So today I'm going to talk a little bit about how every student, every family has manifested in the Escondido region. So the processes and broad timeline that Rachel shared in detail are essentially the same in Escondido as they are in the other regions, give or take some slight differences in the sequence of the integral components. The main difference is that in Escondido, we had a different starting point. In early 2020, which feels like an extremely long time ago, we established a relationship with the high school in Escondido. And at that time, we conducted a student socio-emotional learning needs assessment and presented those results to the school leadership. Fast forward to March, when things took a dramatic turn, we took a pause, and then this fall, in partnership with high school leadership, we decided to shift our focus for the school year to support the emerging needs of students and families related to the pandemic, and then made the decision to expand out into the community, attempting to bridge connections with entities to ultimately and more effectively support students. So now the current focus is on supporting the high school's highest priority at this time, student engagement. This isn't different than the priority pre-COVID, but the needs and approach by default have shifted because students are now learning online and at home, and any socio-emotional struggles have been exacerbated by the ongoing crisis. And there emerged a definite need to connect with both caregivers and students and check in and ask them what they needed the most help with. How could we best serve them right now? It was also apparent that this type of triage really needed diverse stakeholder engagement and necessitates that we leverage existing community resources and expertise as we begin to more broadly conceptualize how to support student engagement from a family stability perspective. This isn't, of course, new knowledge that basic needs need to be met and that students need to feel safe and secure in order to learn effectively, but this reality is legitimately magnified right now. Students are having to do all of their learning from home, and their capacity to engage is affected by the dynamics of that environment. Their access or lack thereof to the tech, tools, and relationships typically supplied on campus and then layered with the stress and tragedy of the pandemic. Next slide. So we started off with connecting with caregivers and families. Specifically, our first step was to launch a caregiver survey that was designed to elicit information related to families' greatest challenges during this time and to garner information on the barriers to accessing support and also potential solutions. Additionally, the high school counselors designed a student progress check survey that students completed in October. And there has been a plethora of regional data that has emerged that is capturing how COVID is affecting our communities, from such entities as San Diego Workforce Partnership, the San Diego Hunger Coalition, et cetera. And we have been strategically utilizing these tremendous resources to inform our direction. I included the name of one publication here, Beyond the Hotspot, supporting equitable distance learning in San Diego County, which was created by the Equitable Distance Learning Task Force here in San Diego. And I recommend you check this report out if you're looking for guidance on how to prioritize both the tech and non-tech needs of students and families, as well as equity-oriented solutions. They outline a connected infrastructure as critical and shared responsibility, and not simply as critical in the short-term COVID response. And we at United Way would agree with that. So all this data, along with the leveraged expertise of our community and school partners who are entrenched in this work, as well as the expertise of the students and their families, is guiding our work to ensure that all students feel supported, engaged, and connected, whether virtually or in person. And we had our first convening of our school and community partners just this week to review all of that data and to start to move. Present at that convening was school leadership, the school parent liaison, and representatives of 3 community-based organizations that focus on an array of areas. So those included are student engagement and empowerment, student and family mental health, and family access to supportive services such as housing and food assistance. And all these organizations are leaders in the community and have a long-standing work in Escondido, but not all have actually been engaged with schools, and others not specifically in this capacity. So we're taking a new approach here. Next slide. So I'm going to go over right now some of the data that we reviewed as a collective earlier this week. These are the key findings that emerged from the Caregiver survey that we at United Way designed for the high school, and that was distributed by them in November. We asked caregivers of students in 9th through 12th grade to assess their needs and barriers to accessing support related to basically 3 bucket areas: their experiences with online distance learning, their family's mental and physical health, and their access to basic necessities, including food, housing, and childcare. So 520 caregivers completed the survey that was distributed in both English and Spanish. 66% of respondents identified as Latino or Hispanic. And as far as what is currently working well, support from teachers, flexibility with the school schedule, and more time with family rose to the top. Regarding their needs, which is displayed here, caregivers' most pressing need for support of those 3 bucket areas was in relation to their distance learning experience in connection with the school. 40% of caregivers identified this as a pressing need. And although this was the most significant area of need that emerged from those who completed the survey in both English and in Spanish, a higher percentage of Spanish-speaking families reported needing support in this area, 62% versus 38%. And we found that caregivers needed the most support in this particular area with their child's motivation to learn online, their child's relationship with teachers and staff, and their internet connectivity. Internet connectivity was also identified as the primary reason for students missing online class. Of those who had a child who had missed class, 63% attributed it to challenges with the internet connection. So as far as the other 2 areas that we assessed, mental health and basic necessities, 24% of caregivers identified support with mental health as a need, most significantly with their child's emotional well-being. And the barriers mentioned to accessing this type of support were that they simply didn't know how to find the type of support that they needed, and having the time to pursue and engage in this type of support. And finally, 23% of caregivers identified support with basic necessities as a need, most significantly with food. And the barrier there was accessing food, was the limited hours of the food distribution sites. Okay, so we can go on to the next slide. So into our caregiver, the high school connected in the fall to do a progress check on their experiences with learning thus far this year. And 690 students completed the survey, and then we at UWSD analyzed data for the school, and here we have some of the key statistics. So significantly, 50% of students reported that they are struggling with distance learning and are not happy with their regarding challenges. These were the ones that arose as the most common. A majority of students don't have someone at home that can assist with schoolwork. Many don't ask help in class when they need it. 36% said that they were not asked for help. Many do not know how to connect with their school counselor, have a quiet space at home to complete their work. And many have competing home responsibilities, such as care of younger siblings. Additionally, poor connectivity still stills attempts to engage online. Next slide. Steps in Escondido are to continue to hone interventions that emerged as promising during our first community school partner convening. A multi-pronged approach started to emerge as we had a diverse set of stakeholders, and there was momentum to pursue multiple avenues. The promising areas of focus that emerged were addressing student mental health and increased access to the type of support that they need, family outreach and connecting them to appropriate social services, internet connectivity, and increased access to and knowledge of regional food distribution resources. So United Way will continue to convene stakeholders regularly throughout the rest of the school year to develop and implement targeted interventions in response to these needs and priorities. And we also continue to reach out to an attempt to include the hardest to reach families and students. We'll be reaching out via phone to those survey takers that expressed a desire to share more. And we will also be working with the school parent liaison to identify some families who may not have been able to take the survey, but who have immensely valuable insight. Also, a priority for us is to actively involve students in the shaping of these interventions and the presentation of the findings and sharing of their experiences with the larger community. So we tentatively have a larger community convening and youth panel scheduled for the end of January. And then upon the completion of the school year, we will collectively reflect upon all outcomes and landscapes if we can sustain and transform its systemic change. But this year in particular is about flexibility, about expanding our capacity to think differently and more creatively about partnership and family engagement, and how we authentically connect with and re-engage our students. One of our goals is to relieve some of the burden on the schools to do it all. We believe this work necessitates broad community involvement and cohesion. Thank you. And with that, I'm going to pass it off to Chris Walsh, who will give you the school's insider's perspective.
Hi, thank you very much. My name is Chris Walsh. I'm a school social worker here in the Lemon Grove School District. And I really want to highlight the importance of collaboration for schools. I think if you're a school and you're not working that much with agencies, I would encourage you to get out there and make those connections and have people who can be liaisons to the communities. Because what we found in Lemon Grove is that schools alone can't do it by themselves. And we really appreciate that United Way had stepped in a couple of years ago and helped us with our attendance project. We're at Vista La Mesa, where I work. We're a K-8 school. We're a neighborhood school. Our average attendance is actually pretty good at about 95.3. But we find that our families really struggle. A percentage of our families struggle with transportation, with work responsibilities, poverty, and mental health. Those are just some of the barriers that keep kids from getting to school on time. And United Way, recognizing this, stepped in and offered to help us out. What they did was they assigned a dedicated social work intern. This is somebody who could meet on a regular basis with kids. Each week, that intern would meet with the child, and it gives a child a feeling of really being important, that somebody would notice whether they were at school or not. And so it really increased our capacity here in the school to reach out to kids. The intern also operated our incentive program. It was a lot of fun. We dressed up like superheroes. We went in and gave out keychains, and the kids really loved it. We did that with our younger group to address the soft truancy. The kids where the parents think, well, it's just kindergarten. We don't have to worry about school. So we really got the kids excited about being here, and we were able to improve that attendance. United Way also provided wonderfully some incentives for kids. And so we had gift cards for kids who are making progress and for parents. And they also provided gas cards, which was a barrier for some of our families. It was hard to have the money always to drive here to school. And so we were able to make those gas cards available to families. And what was really neat was we were able to connect some of the families that weren't able to get to school so they could carpool and drive each other. So that was really appreciated. But when COVID hit, we really found that we had to look at our community partners differently. We had to think, where are we going to find the food resources we need? Where are we going to find the mental health resources? And I think one thing that I want to point out is that schools really can be an important hub for delivering these services. For example, we're a military school, and one of the local mental health agencies realized, hey, we have kids at that school who have insurance already with TRICARE, but their parents aren't able to get them to appointments because they're working all day in the military. But if we can send somebody to the school, a therapist who can support those kids, we can provide that service on a very regular basis. And so that's what they did. And so I would really encourage you as an agency not to think of a school as a place where just education is done, but really where we can serve some very important and very basic health needs for kids, especially in the area of mental health. We can really do a lot of great prevention work. In fact, at our school now, the Navy has supplied a therapist who does early intervention work with mental health, and then also work for kids who have clinical diagnoses. So if you're not involved with schools, really do think about it as a place where you might be able to serve your community. So when COVID hit, we really had to think about how to serve differently. And it was really very helpful to have United Way say, we're going to expand what we're doing. We don't want to just stick with attendance. We really appreciated the fact that they had stepped up and done the survey and identified food as the main resource. We were able to get the information out through our class dojo, and the survey was taken by about 50 of our parents, which was a good response. It was a surprisingly good response. But we were concerned because we were doing food distribution, and the food distribution wasn't as effective as we expected. We have about 75% free and reduced students here, free and reduced lunch students. And we found that probably we were getting about 60 of our 600 students coming to pick up food. So we said, boy, something's, not quite right. And so we want to do the next slide. This is an example of our food distribution site. You can see it's kind of lean and mean. We're out there in all different kinds of weather. Families drive up. It's no contact. They can just open their doors and the food gets put in the trunk or in the back of the car. And we have a tremendous nutrition services staff. They are out there. We did 300 lunches the other day during our award ceremony, and they were busy. So we really, really appreciate our nutrition services staff. So United Way really came in and helped broaden the perspective. Schools sometimes can, there's so much to do here, but schools can think more in a way of a silo. And so by bringing in community partners, United Way said, let's bring in the Hunger Coalition, let's bring in San Diego Food Bank, and let's think about this together and think about how we can do things a little bit differently and a little bit better. And as I said, we have a wonderful nutrition services staff, and Holly Bauer, our Director of Nutrition Services, was open to finding out how can we serve better? How can we do a better job? And I'm just really proud of that whole group. And what Holly was open to was opening up to different dates and times and looking at when families could be here. We started off at 7:15 to 9:30 in the morning, but that was also the time when families were getting up and trying to get on their computer. So naturally expanding maybe to afternoon and evening was the first thing we started to look at. We also thought we could improve on the flyer and not just give information about our school-based resources, but also what are the other resources in the community that we can share with people. Things like CalFresh and some of the other distributions in the area. So some of the strategies that we came up with were to definitely have a better flyer, and we feel that's going to make a big increase in participation. Our times of distribution. And then in the summer, we had been limited to having only our students receive food. And students had to be present in order for families to receive the food. But what we've expanded to now is to have children from 0 to 18, and the children don't have to be present. So if the kids are home on their Zoom classes, the parent can pull up, say, okay, I need food for 3 kids. and that food will be filled up and they can take off and enjoy that food. So it's really streamlined things for parents and made it a lot easier. We've also found that pairing the distribution with different fun events like awards presentations or even our equipment distribution when we give out new textbooks or consumables, we get a lot more parents in using the food distribution. So we're going to continue to try and look for events to bring in more parents. And we're really looking forward to expanding the percent of participation of our parents. And we're, again, very grateful for all the work that United Way has done, also the Hunger Coalition, and also San Diego Food Bank with us, as well as our community participants. Thank you.
Thanks, Chris. And just to sort of summarize some of the themes that we're touching on here, we wanted to kind of reflect on lessons learned and highlights from the work, and also challenges that we've come across in the recent months. And fortunately, a positive lessons learned, for me at least, is that organizations really do want to partner. I was just thinking, you know, with everyone being spread so thin with the pandemic, both in their personal lives as well as, you know, community-based organizations, I wasn't sure the kind of response we would get as we were planning for this shift, every student, every family, and focusing on this 1 year COVID response and needing to fold in new partners to support that work of whatever focus area our partners decided on. You know, would we be able to get more folks to sign on and lend their time and resources? And we found that actually there's, in my opinion, an increased spirit of collaboration due to the pandemic. I think folks are recognizing that more than ever, we need to work together. Like, we cannot do this alone. So for example, with the survey that we did for City Heights and Lemon Grove residents, you know, we reached out to a lot of organizations that we had not worked with previously in Every Student Every Day, and talking about this effort that we were trying to do of collecting community voice. You know, if we were able to get in touch with an organization and kind of get that conversation going, it was overwhelmingly, yes, you know, we'll try and support that work. I think what also helped is that for at least our data collection, we were able to say, we will of course share back the results with you, and if you help collect responses, we can create, you know, a customized summary of the results of just the folks that you were able to survey to, so that it can help inform the work of your organization with the folks that you work with. And then beyond the survey, talking about just this partnership of every student, every family, reaching out to other organizations to somehow, you know, help contribute to this work of raising awareness of food resources, supporting students and families, and in Lemon Grove, adding an additional food distribution time. Folks really, you know, have embraced that spirit of collaboration. And so this is a positive lesson learned from this year, which is that if you ask, folks really want to try and figure out a way to make it happen. And I'll have Maria kind of share about this next lesson learned and challenge that we have.
Okay, so prioritizing community voice is one of our top priorities, but it's also been challenging, particularly in a time when the rules have changed dramatically and where time is of an essence. But I know none of us are interested in creating something that doesn't serve people, that doesn't work toward creating solutions that are meaningful and pertinent to the actual lived experiences of the students and families. So as far as lessons learned, first would be to engage the community with authenticity, ask families what they need and want right now, and then respond accordingly. Prioritize their voices when convening partners to design a support intervention, looking beyond perhaps your immediate mission to see how you can meet those needs. For us, in-language connection has been key, personalized outreach, as well as continuous well-being check-ins, and taking advantage of already cultivated personal and trusted relationships among our community organizations and school families. Another lesson learned is to merge efforts, collaborate, and get creative with partnerships to reach all sectors of the community. And another is to strive to have family members and students in leadership roles in the design of this work. So, I mean, this is all the things that we are actively striving to do and to improve upon, knowing that this is challenging and also that it requires a great deal of flexibility. And that we're all accepting of have to be accepting of that, particularly during this time.
And sort of the last thing that we'll highlight with a general challenge that I think a lot of people can relate to, which is doing this work from a distance. One positive from that is, at least for the monthly convenings that we're having for our City Heights and Lemon Grove partners, is generally, because it's virtually, we find that folks maybe have a bit more flexibility to pop into a meeting because they don't have to do that driving and going to in-person stuff. You know, if they have the technological capability, then folks can kind of jump in and work together from a distance and pop into meetings. But as I kind of mentioned earlier, if you have a large group of people and you're facilitating consensus and decision-making, that is always challenging, you know, under normal circumstances and in person, and then you add doing it in a virtual setting, and that certainly created a host of challenges that, you know, we had to just think through in terms of that facilitation. I don't believe I have anything super groundbreaking to share regarding how we do that. You know, everyone has learned some tips and tricks with Zoom and other platforms. But I would just say that being flexible is sort of the key that we've really had to embrace more than ever, and just assessing barriers to participation that we have in our work. Like, for example, we would normally have an MOU, you know, that we would have partners sign to join into this work that we're trying to imagine together. And for this year, we said due to the time frame and the number of partners that we have, our sort of agreement is going to be a document that we share of partner expectations, and we just ask for an email back saying, yep, read it, agree, and, you know, I'm going to try and commit to those things. And that's all we did for this year. So just being flexible with all the pieces of working together and partnering together and doing it from a distance is how we've strived to make this happen together for this year. So with that, we now have, you know, the rest of our allotted time together to answer some questions that you might have that have come up for you in the course of our presentation. So we'll kind of go to the chat box and see what questions are already there, and please take this opportunity to add additional questions that you might have. And if Maria or Chris, you might be able to elevate any questions that are in the chat box. And I can't really see it too well since I'm sharing my screen.
Yeah, Rachel, there's a question here about, we're asking, were the stakeholders, parents, students, etc., involved in the design of the food program?
Can you repeat that? I didn't hear the beginning of the question.
Yeah, were the stakeholders, parents, students, etc., involved in the design of the food program? So yes, I would say that challenge of, you know, embedding community voice in every step of the process, it really started with the survey that we had and hearing directly from residents around what are the top need areas. So that's how we landed on food, along with the other lenses that we utilized. But then going back to what the families said who live in City Heights and Lemon Grove around what's contributing to food being a top barrier, that was also folded into what the partners agreed of what the response would be. So because we heard that just
not being aware of all the great resources that are out there was a barrier that was built into both the response in City Heights and Lemon Grove. And then in Lemon Grove, also addressing that barrier of the times that food distributions are available. A through line in our process is always stopping to reflect and look at who are the voices that we really need. Are they at the table, or are we eliciting those thoughts and ideas authentically? So I would say for our group of partners in City Heights and Lemon Grove, we have had community residents and family representatives there at our monthly convenings, but the number of folks that we have, is lower than we would want. And so we've assessed additional ways to, authentically engage families and student voice. So what we're doing with City Heights and Lemon Grove is we've extended invitations to anybody who completed the surveys to join and regularly participate in the Every Student, Every Family convenings. We have as many parent liaisons from our schools as we can possibly have as part of our list of partners. And then thinking about embedding in all of the important decision steps along the way of embedding community voice. We're thinking of maybe some of the partners that we have in Every Student, Every Family who can help us raise awareness, but they're a little less directly connected to working on food insecurity, but they work directly with community residents. So can we leverage the great client relationships that they have to fold into the work that we're doing and utilize the knowledge and expertise of the folks that they work with in the community? So those just some of the steps that we're taking in City Heights and Lemon Grove.
As a school district, one way we've tried to be more responsive is we put out a flyer to all of our parents, and it had the phone number of the nutrition services person at each school. And so families could give input and give suggestions. And that's a big part of the reason why we've made changes. The other nice thing is that people who work at the school, whether it's nutrition services or board members, they are parents. And they have all been a part of this discussion and improving things and tweaking things. When we started, we were giving out for the week 7 little milk containers for each child. Well, if you have 3 children, that's 21 milk containers, and 21 little juice containers. And we thought, what if we give out whole half gallons of milk? And now when people come to that drive-through, it's a little bit, they leave looking like they went to the supermarket because they're getting whole heads of lettuce. They're getting half gallons of milk. They're getting whole huge containers of yogurt. So we've responded to trying to make things easier for families so that it was easier to store at home and utilize on a daily basis.
Okay, Rachel, there's another question. It says, how many participated in the community needs assessment that drove the plan for the entire school community?
I want to make sure I understand the question correctly. So how many partners do we have participate in the survey that led to that decision?
It doesn't specify partners. It may be meaning respondents or community respondents.
Oh, okay. Yeah, we had 326 responses to the community survey for City Heights and Lemon Grove, and it was fortunately a nicely evenly distributed ratio between folks from City Heights and folks from Lemon Grove. So we felt confident that we had a reliable data source to then use for that decision making with the group. Okay, so if there are any other wonderings, we'll just leave a minute or two for folks to enter that into the chat box.
One thing also I want to share with schools out there is that I think it's helpful to have somebody in the role of a school social worker. It's a role that is expanding into a lot more school districts. But what's nice is, schools are always looking inward about, taking care of classrooms, taking care of students. There's so many needs during the day, but having somebody turned outward who's ready to be that liaison with the community is really helpful and really opens the school up to a lot more opportunities, whether it's something basic like this and local, or whether it's a national grant. So I think that if you've never worked with a school social worker, I would recommend considering it. And we're always welcome to talk to other school districts about how to get started and get a school social work program started. Janae Peavy at the County Office of Education is also available to answer any questions about the benefits of having a school social worker.
Okay, so we have another question that says, how did you get so many responses for the Escondido surveys? And so I would say with that, I would probably attribute that to the leadership at the school in Escondido and the tremendous relationship that the parent liaison has with the families at that school. And that there's just a lot of enthusiasm at the school to help their students and to try to figure out, because they've been working really hard to do so, but certain things aren't working. So trying to figure out how. And so I know that there was a concerted effort to get responses so that we could have an accurate kind of understanding of what the biggest needs were. You know, the student survey was designed by the counselors at the school as well. And I think that, you know, they had connections to the students. And so, and I think it was prioritized that they get those responses so that it could adjust.
I'm wondering if, Chris, if you have anything to add to that, because the survey that we did for City Heights and Lemon Grove of our school partners that helped distribute that survey, you know, your school had the highest number of responses out of our partners. So I know you talked about Class Dojo, but are there any other kind of tips or tricks that you can share about getting surveys and other things completed?
I think it really starts with building relationships. As a school, we have to show that we're here for our parents. Parents sometimes forget that we work for them. And we have to remind people of that all the time and build those relationships. And once you do that, people will look at Dojo as a source for real information, as stuff that's useful to them, and then want to participate in it. One of the things we've just started up here is a grant for a community garden so that we can bring people in during the school year, also during the summer, and you know, have activities like that that can build that sense of community and sharing. School has to be a place that kids want to come to, and that where parents want to leave their kids at the beginning of the day. And if they feel that, it makes a big difference. Having an after-school program has been wonderful for our school in building relationships and responding to the needs of families that aren't available to watch their kids from 6 to 6 because they have to be at work. So really, I think that any communication device that you use really has to be backed up by, you know, an enthusiasm and wanting that relationship with families.
Well, it looks like we've addressed the questions that we've had, and we just want to say, you know, thank you everybody for joining us in this session. Like I said, we were looking forward to it, and we're very happy to have you with us. And so we wish everyone good luck in everything that they're doing nowadays, both in their work professionally and at home. So thank you all. And I guess we'll just have a few extra minutes between now and the next session, and y'all can take a break. So thank you.